Hello，大家下午好，欢迎来到 NSMH 升华医疗中心的 Facebook Live。这一次呢，是我们第四次做直播了。所以今天呢，我们想要讲的主题是What is Jaundice？ 所以这一个 presentation 呢，会 mainly conducted in English。所以我今天要换个调调哈，所以需要讲个英语。So good afternoon to everybody. Welcome to NSCMH Facebook live session. First, I'm going to introduce myself. My name is Michelle. I'm the pharmacist of NSCMH Medical Center. Today, we are very happy because Dr. Chu JOLING, she's a pediatrician since 2015. She's going to share with us what is jaundice. So in Chinese, we said 10个宝宝6个黄. So which means out of 10 babies, usually there are about 6 possibly with jaundice. So today, Dr. Chu is going to share with us, is that true? Is the myth true or not? Secondly, a lot of patients, they are always really concerned. They say that breastfeeding may have caused jaundice. Is it true? So these are all the topics that we are going to discuss today. So if you think this session will be beneficial for your friends, for your mummies, for your, any friends, please do like and share our presentation so that towards the end, Dr. Chu will be able to answer your questions. So the presentation will be about 45 minutes. Dr. Chu is going to share her presentations for about 15 to 20 minutes. After that, we are going to have our Q&A session. So please stay tuned. Without any further ado, let us welcome Dr. Chu. Hi, Dr. Chu.
Mute. Hi, hello.
Hi, Dr. Chu. And no problem.
Yeah, so today I'm very glad to be able to share about this common topic. Okay, so we're going to talk about neonatal jaundice. Okay, I think most of us as parents, first-time parents, or any newborn parents, okay, will surely be likely to come across this problem. Okay, so we shall talk. I shall start my presentation now.
Sure.
Yeah. Okay, let me get the slide up.
Sure.
Double click. Okay. Okay. Wait. Okay. So this is so first thing first. What is jaundice? Okay. So jaundice is basically when we see a yellow discoloration of the skin and or the white of the eye. Okay, due to bilirubin accumulation of bilirubin in our body. Okay, so usually jaundice is a sign. It can be a symptom of a liver or blood disorder. Okay, it's not painful, and for babies, usually the jaundice will happen in the face. Will be seen on the face. Later down, it progresses down to the chest, abdomen, and lastly to the legs. Okay. So how usually we, parents always ask how to see jaundice. They can't really differentiate it. I agree. It's not easy for young parents. Okay, first-time parents, because we see the babies every day. So we can't really tell suddenly if the baby is jaundice. Okay, so this is how we see from this picture here. Okay, that it's most visible in the eyes. The white of the eye, we call it the sclera. Okay, but definitely babies, we don't open their eyes this way up. Okay, it's very uncomfortable. Okay, in adults we can see this. Okay, it's that in the eye. Okay, so babies, what we do, we pull their skin tight. Okay, over their chest here, this area. Okay, we just pull it tight. Then we just see whether the underskin there it's yellowish or not. So I should say that it takes a bit of experience, but you will get the hang of it if you see a few babies with jaundice. Okay, so this is just how we visually assess whether the baby is jaundice or not. Okay, so causes of jaundice, I will be talking a bit later, but fair to say that about 75% of newborns become jaundice during the first week of life. Okay, so it can be a normal jaundice, or we call it physiological, or abnormal, problematic, which we call it pathological. So we shall go through the causes of normal jaundice first. Okay, so when do we say it's a normal jaundice or physiological jaundice? And usually 75% babies turn jaundice. So usually it happens after 24 hours of life. Okay, and it peaks at day 3 to 4 and then plateaus about 1 week of life. Usually by 2 weeks of life, the jaundice will resolve. Okay, so you can see in this this picture here, okay, a jaundice baby and a normal baby. So even if you can see in the picture, you're not sure whether your baby is jaundice, you compare with your own hands. You should be able to see a bit of difference. Okay. So this is a very good diagram to quickly summarize how jaundice happen in baby. Okay, so we look on the diagram on the left-hand side first. Okay, so this jaundice is caused by bilirubin, a pigment called bilirubin. Okay, so bilirubin comes from red blood cells. Okay, that is broken down. Okay, so red blood cells have their lifespan of 120 days. Okay, so when it's broken down, okay, the waste product that comes with it is bilirubin, or it's also a yellow pigment. Okay, bear in mind that this bilirubin, which has been broken down, okay, it's not normally soluble in water. Okay, so what happens is our liver will need to process this bilirubin to make it water soluble so that it can be excreted from our feces and urine. So in babies, what happens is we have a surplus of red blood cell, okay, which rapidly dies off after birth. Okay, so this is a physiological thing that happens in babies because they need to have more red blood cells when they're inside the mommy's uterus. Okay, so when they're born, okay, there is a surplus of red blood cells. Okay, so this causes a lot of bilirubin to be created. So when there's too much of bilirubin, insoluble bilirubin, okay, their liver is not able to cope with the surplus of unresolved water-soluble bilirubin. So it gets accumulated, okay, somewhere else in the body. Okay, so only a small amount of only a small amount of bilirubin that can be excreted by the liver to the stool, whereas those that are not water soluble, they're actually fat soluble. So this fat soluble bilirubin will be stored in other parts of our body. Okay, so making them looking yellow, skin and the eyes looking yellow. So I hope everybody can follow me. So this is to say that bilirubin is slowly removed in the newborn much slower than normal adults. Okay, it's because of babies have immature liver. Okay, so there's a mismatch. So now we come to abnormal jaundice. When do we consider jaundice to be abnormal? So abnormal means pathological. So problem is when we call babies have pathological jaundice is when they have onset of jaundice within the first 24 hours of life, or there's a very rapid increase in the bilirubin level. Okay. Another problem that we always see is when babies have prolonged jaundice. Okay, this is very common. So in-term babies maybe meaning babies which are that have completed 37 weeks. Okay, born after 37 weeks of gestation. So term babies, we would classify them as to have prolonged jaundice for more than 14 days. Okay, in preterm babies, meaning those less than 37 weeks, okay, we give them up to 21 days of life. If they have jaundice more than 21 days, then it's prolonged. So what can be the cause of problematic pathological jaundice. So one of the main main cause is due to excessive breakdown of red blood cells or hemolysis. Okay, commonly seen in mothers and babies with blood group incompatibility. Okay, it's not to say incompatible to what, just a small incompatibility. Usually this happens with mommy who is blood group O, okay, or mommy who are rhesus negative group. Okay, so if mom has blood group O or negative with the rhesus negative, okay, what happens is mommy develops antibodies towards A and B antigen or the rhesus antigen in the baby's blood cell. So during delivery, some of the baby's blood might be mixed into the mother's blood that go through the womb, and it could attack the baby's red blood cell. Mom's antibody might attack baby's red blood cell. Okay, that causes baby to be jaundice. Okay, so another common problem is if the baby has G6PD. G6PD is basically an enzyme, 酵素, enzyme in the baby's red blood cell. Okay, so red blood cell, as I said, is a cell, okay, that needs to go through small areas in the body, okay, and it releases the oxygen to our cells. So because it needs to go through small areas in the body, our body has this enzyme which is called G6PD to help maintain its cell membrane. Okay, so children or any individuals with G6PD deficiency, they are not able to maintain the integrity of the red blood cell. So thus it breaks up easily. So when baby is stressed out, an individual with a G6PD, especially the babies, especially that they have gone through delivery, which is a stressful event, okay, this will cause that their red blood cell to break down excessively. Okay, so these are the main two problems that we always see in babies that can cause baby to have very high jaundice. Okay, some certain drugs also can cause jaundice. I shall not elaborate here due to time. Okay, so other common things, common problems that we see is having blood clots. So babies having blood clots somewhere in their body. So usually when we see this is kappa hematoma, which is the clot over the scalp of the brain. Okay, this commonly happens during labor when baby's head is eroded in the vaginal canal during the labor from strong contraction. So after delivery, we might be able to see that the baby has a bit of swelling over the head. Okay, it's not painful, it's just firm swelling over the head. Okay, so these are due to blood accumulation under the scalp. So as of any bruising, the blood needs to be taken off, the dead blood cell needs to be taken off, and it will cause jaundice. Okay, there are sometimes bruising during delivery, during the labor. Okay, or sometimes the baby's head get congested during the delivery process. Okay, so any of this can cause blood clot accumulation or bruising. Okay, sometimes certain babies develop excessive red blood cell. Okay, or the medical term we call polycythemia. This condition happens when babies are stressed out in the fetus or the babies in the stomach. Okay, mommy's uterus are stressed out. Okay, so the stressful event in the uterus can cause the baby to produce extra red blood cell. Example of the stressful period is probably when there's insufficient placenta blood exchange in the uterine womb, or if they have fluctuating blood glucose level. Okay, so I shall go on. Okay, so other causes can be due to infection, okay, or any problems with the gastrointestinal or especially the liver. Okay, so this slide tells us about risk factors. So which sort of babies tend to get severe jaundice? Okay, so I think this is very important for us all to know. Okay, so first thing first, premature babies. Premature are those babies born below 37 weeks. Okay, so due to their prematurity, it means that their liver or their organs are not well developed, so they might not be able to cope with the extra bilirubin weight. Okay, another thing is if they have low birth weight. Usually low birth weight is when you have birth weight is less than 2.5 kilos. Okay, so that means that similar, their organs are less able to cope with the extra load. Okay, others are, as what I said here, sepsis, diabetic. If you are diabetic, uncontrolled diabetes, okay, if the baby is dehydrated or you have breastfeeding problem, okay, so on and so forth. Or even if you see if your siblings, if you have other children, okay, who has history of severe jaundice, so likely your current baby might be having a severe jaundice as well. Okay, there is a genetic factor there. Okay, other than that, being Asian, we are also tend to get jaundice more often. Okay, so is there any questions? I will go on. So please do ask questions if you have anything in doubt. Okay, I will try to answer later on. So now I shall talk about correlation between breastfeeding and jaundice. There is a definite correlation between these two topics. Okay, so what do we say? When do we call it breastfeeding jaundice, and when do we call it breast milk jaundice? Okay, so I shall go on to a breastfeeding jaundice. This happens usually in the first week of life. Okay, when there is a breastfeeding failure or very young parents, they are not used to breastfeeding. Okay, so when there is inadequate milk supply, or sometimes baby just tends to be sleepy, they don't want to suckle, okay, or the baby doesn't feed well, doesn't suckle well, basically poor feeding technique. So this leads to loss of weight, dehydration, okay, causing baby to not be able to process milk. Okay, so remember that bilirubin is excreted through the stool and urine. So when there is lack of milk, so there'll be less of urine, less of stool, that will cause the bilirubin to increase. So baby might tend to get more jaundice. Okay, so what can we do to overcome this is frequent feeding. Okay, and I think most mothers now I would advise that most of you new parents to go for breastfeeding classes to get a hang of how to breastfeed. Okay, so that you can anticipate problems that might come on during the breastfeeding. Okay, so nevertheless, I would say make sure that baby has adequate feeding. If there is not enough breast milk during the first few days, please do top up with a formula milk. Okay, so now we go on to breast milk jaundice. So this is another entity. Okay, so there are some myths saying does breast milk cause jaundice? Should I not breast milk then? Okay, so basically it is true, breast milk can cause jaundice. Okay, so there are evidence that there are certain substances in the breast milk that can block the proteins in the liver, which is responsible to break down bilirubin. Okay, so this is relatively not a very severe condition, not something that we should be very worried of. Okay, because usually this breast milk jaundice won't cause baby to have problems. Okay, it just causes baby to have jaundice for a prolonged period of time. Okay, so this is why when we say that if your baby is well but still jaundice within 2 weeks of life, okay, we need to screen baby for any problems. If everything turns well, okay, then, and your baby is full mainly on breast milk, so then we come to a conclusion that this is most likely due to breast milk jaundice. Okay, so rest assured, this is not a reason to stop breastfeeding, okay, and it rarely needs any treatment. Okay, so I touched a bit about prolonged jaundice. So I mentioned already. So what are the things that we are worried of during this time? Okay, is we would like to see if we can detect any problems with the thyroid. Okay, some babies tend to have low thyroid level that can cause jaundice. Okay, some babies have a surgical problem or that in the liver, or we call it biliary atresia, okay, which needs urgent surgical intervention. They need operation to correct this. Okay, so other common problems is urinary tract infection. Okay, very commonly babies who are born with urinary tract problem can come to have infection and cause them to be jaundice. So how do we screen for jaundice other than the visual assessment? Okay, so we can test the jaundice using two other methods okay, one is this high-tech small camera thing. Okay, it's what we call a transcutaneous bilirubinometer. Another better assessment is taking blood. Okay, so we talk about a visual assessment first. Okay, if you can see here in my diagram, okay, so usually babies start to get jaundice when we can see it from their face. Okay, as the jaundice progress further, it will go down towards the feet. So basically, I would say that if it's below the knee level, usually the level is more than 250. Which definitely needs some intervention. Okay, so that is a general rule. Okay, but don't need to worry too much about this. Okay, if you feel that your baby looks jaundice, just come for a test. Okay, and remember there is no phone app that can tell you how jaundice your baby is. Okay, so you basically have to get your baby tested. Okay, either from using this, if the center that you are in, okay, has this machine, or by taking blood. Okay, this is the best assessment tool. Okay, it's basically most sensitive to pick up. Okay, so now we talk about complication of jaundice. So I get many parents asking, doctor, why worried about jaundice? Every baby also jaundice. My baby all also jaundice before, no problem. Why are you keep asking me to come and check again? Okay, so basically jaundice, yes, it's very common, but high jaundice can cause problem. Okay, so we are most concerned about having brain damage. Okay, so babies have a very sensitive brain. It's not well developed. Okay, so unlike adults, we have a blood-brain barrier. We have a good coating for the brain. Okay, so any infection or any toxin don't easily get to the brain as easily to the adults. Okay, we basically, because we have this barrier. But in babies, this blood-brain barrier is almost non-existent. So it doesn't protect the baby. So whenever we have high bilirubin, which is a toxin to the brain, okay, so it can potentially go into the brain and stain it and cause damage. So you can see here, this is a post-mortem of infant's brain, okay, that has had a high jaundice. Okay, it has stained this area of the brain, and it will not go off even when they are adults. So this can cause permanent disability. Okay, so I wouldn't say that the baby will die, but they will be crippled. They will have some complications. They will be cacat lah. They might not be able to walk, or they might not be able to learn well after if they have a very high jaundice. Okay, so what are the signs of high jaundice? Okay, so the first sign is usually when we see the jaundice is the baby is very jaundiced, very yellow. Okay, it's seen over the knees or lower. Most of the time when I see the jaundice is up to the feet, it's bad news lah. Okay, so basically jaundice baby have difficulty in feeding. They don't like to feed. Okay, they just don't swallow. They don't feel comfortable. Okay, some babies might be sleeping all the time. Some babies might be just crying all the time. Okay, I think this is probably due to having a very bad headache. Okay, some babies, if you see from this diagram, it looks like they are in pain. So what they are doing is they are arching their back. Okay, this is a sign that high likelihood that the bilirubin has damaged the brain. Okay, causing the baby to do this. So basically our aim in treating jaundice is to quickly and safely reduce the bilirubin level lah. Okay, so normally mild jaundice we don't need any treatment. Okay, and if you have a premature baby, okay, we need to treat the baby at lower level of bilirubin. So these are the numbers that we doctors use to guide us when shall we start treatment. Okay, we have basically risk. We need to stratify the risk. Okay, whether your baby is a low risk, medium risk, or high risk, or whether your baby is term or not term. Okay, and if you can see from this diagram, we have so many numbers, and depends on the days of life. If you are young, less than 24 hours, it doesn't matter. You look jaundice, baby looks jaundice, we will need to start treatment and do investigation. Usually the jaundice will start after 24 hours. Okay, and you see that the numbers increase. It doesn't stay at one number. So some parents ask me, when shall I worry? It's very hard for me to tell them what number should they worry or what, because it changes every day and it really depends. I have to see the baby to assess their risk factor. Okay, so if you think that your baby is jaundice, please do come and see the doctor for us to assess your baby well. So this is also another diagram. So it's showing what are the jaundice level, bilirubin level to start treatment. So it's impossible for me to remember. Okay. So jaundice treatment. So first thing first, what we can do as parents, we should encourage feeding. Make sure baby has adequate feeding. Okay. Either if you don't have enough breast milk, please do top up with formula milk. Okay, and make sure that baby has passed a lot of urine and stool. So I would say you check your urine. If your baby's urine is clear, yellow, clear, that's good. Okay, you wet about 6 diapers a day. Okay, and the stool is also important. Make sure your baby's stool is not black. It shouldn't be the dark green, sticky dark green. It should turn yellow, bright yellow or brown. Okay, and in good amount, large amount a day. Okay, so and usually if baby is satisfied, they sleep well. They can sleep 2 to 3 hours, then they will automatically want to feed again. If your baby don't feed, don't sleep, I mean wakes up first 2 hours crying again, meaning that they haven't been feeding well. Okay, so if say we tested the bilirubin and seems that the baby needs to be on treatment, fret not, the treatment is very easy. We just give phototherapy. Okay, so basically how phototherapy works is that we expose the baby's skin to blue light. Okay, and this blue light actually is able to break down the bilirubin underneath the skin. Okay, and it's usually done in the hospital. So these are the examples of photo light that we have. Okay, so many types. Okay, so there's a Billy blanket, there's this that goes into the a chamber, okay, or just this fluorescent lamps. Okay, so nowadays we tend to use LED light, okay, which has good intensity. So what happens during phototherapy? We expose baby skin to the light as much as possible. So we basically need to, baby doesn't need to be on any clothing, only on diapers. And we need to put the baby on eye patch to protect their eyes. Okay, phototherapy should be continuous and only break during feeding. Okay, so usually we will give the phototherapy for about 24 hours. Then we will test again the bilirubin and see how much it has dropped. Okay, so we have a level to be able to let the baby discharge. Okay, but remember that jaundice might rebound after 24 hours. So don't need to worry, it really needs treatment. Okay, so some patients said, don't need phototherapy, I just put the baby under sunlight lah. Okay, that's what our grandfather do. Okay, I would say this is not recommended. Okay, because baby, first thing, Malaysian sun is very hot. Okay, so it might expose baby to sunburn or dehydration. So I wouldn't recommend this. Okay, so and if you were to do that, you can't, the amount of UV light that the sun emits is not as much as the phototherapy. Okay, so it might not be that efficient to bring down the bilirubin. Okay, so this is just a slide to let parents know what can be the side effect of phototherapy. Basically, there's not much side effect. Okay, so babies tolerate phototherapy very well. Okay, some parents might think that, oh, my baby exposed, will it be cold and all? So usually the photo light does have a bit of heat underneath, so you don't need to worry your baby won't feel cold. Okay, and but sometimes babies do develop some skin rash or diarrhea during phototherapy. Okay, this is very mild, and usually it won't last very long. The moment that we take the baby out from the phototherapy, they turn back to normal. Okay, some babies who are exposed to phototherapy for excessive numbers of days, maybe about 3 days or so, then they might become a bit darker skin. But this will also resolve after some time lah. Okay. Okay, so this is just a quick slide about treatment of severe jaundice. So some babies do tend to get very severe jaundice, so high that we think it's unlikely for the phototherapy to calm down by itself. So in this sort of case, okay, the baby will need to be admitted to the ICU. Okay, he will need to get his umbilical cord, the baby's umbilical cord here, okay, to put a tube inside, and what we do is we take the baby's blood out and replace it with the new blood from the donor. So this is a high-risk procedure. This is a high-risk procedure, okay, and we hope that we do not need to do this procedure, but this is still the best way for us to treat, to bring down the bilirubin level as fast as possible. Okay, so this is usually done in our GH, okay, where there is a team of expert team of doctors and nurses, and it has to be done in the ICU setting. So I would not want to see this to happen to any of our babies. Okay, so I think we've come to the end of our presentation. So take home message, okay, please, if you have a newborn, you're expecting a newborn, Monitor your baby's skin color every day, especially the first week of life. Okay. Follow your schedule to see the doctor. Okay. Even if you think your baby is well, just go and see the doctor to make sure everything is okay. Maintain good feeding. Okay. Make sure baby pass motion well every day, and you change about 6 wet diapers every day. Okay. So thank you very much. If you have any questions, you can feel free to ask me.
Okay, thank you, Dr. Chiu.
Yeah.
Yeah, let us remove the share slide first, yeah.
Stop sharing. Oh, okay.
Okay, so back to us now, Dr. Chiu.
Hi.
You're sharing just now. I think what the parents should do is snap photo of the slide just now, because your slides are so thorough, you know, in detail, and then maybe whatever you have already explained just now, I possibly would have forgotten. So later we may ask the questions that may already in the slides, but I guess it's no harm just to repeat it again, right? So
Yeah, I see here that some parents asking, does the total serum bilirubin less than 250 considered as jaundice? Does it require phototherapy? Okay, so as I mentioned, the bilirubin levels that we need to treat differs every day. Okay, so I would say 250 is the level that we use after day 4 of life. When baby is day 4 onwards, then I would say 250 above, your baby is considered pretty jaundice. Okay, you might need phototherapy. Okay, if your baby is at day 1 of life and it's already 250, that is very high. Okay, that is very, very high. So I wouldn't, please don't take note that 250 then only I worry. So every day differs. The first few days is very crucial. Okay.
Okay.
Yeah.
So 250 is not an indicator, right, doctor? Which means I cannot, based on that, the factor for us to decide if we need to do the phototherapy or not.
Correct. So it's basically just a very, if you really want me to say something, I would say, yeah, 250 is a number after 4 days. After when baby is
4
day
days.
4, day 4, and you tested your baby is, let's say 280 or 300, yes, definitely that will need phototherapy already. Okay, so if it's 220, then we might still need to, your baby is still jaundice, it's still considered jaundice. Okay, so I didn't put in my slide. So basically babies are visibly jaundice when their bilirubin is more than 80.
More than 80.
Yeah, then they look jaundice already. Okay, so it's a matter of whether when we need to start treatment. Okay, so don't think that less than 250 means that not jaundice, meaning nothing. They're still jaundice, but we don't need to we don't need to give phototherapy. We still need to monitor.
Still need to monitor. So have you come across, I'm not sure whether the statistic is correct or not, you know, we say like out of 10, there's 6 with jaundice. So based on your experience, how many babies that actually require treatment and how many that actually don't require?
I would say out of 10 babies that we see, maybe 8 or 9 we pick up
Maybe 8
jaundice.
or 9.
Yeah, we pick up jaundice, but not maybe only 3 or 4 really need to get admitted for phototherapy.
Oh, I see.
Okay.
Like
So,
out of that, another 3 or 4 that actually requires phototherapy.
Yeah, correct. Okay.
Some of them, they can, you know, slowly go away by themselves.
A lot of it, most of them, it will just resolve. But I would need to emphasize that this needs to be monitored. Monitor so that it really resolves properly.
Okay. Thank you, Dr. Chiu. Let me have a quick look at the comments. Okay. Mr. Go, at what bilirubin level does the baby needs to do blood transfusion?
Okay, so maybe I go through the slide. If you're really interested in numbers, share. Wait, let me go through the slide. Yeah, yeah, 8, 4, 11, 10. Okay, so this is the quick diagram lah. Okay, so we have a number here that you can see, ET. ET means exchange transfusion. Okay, so depends on what risk your baby is. Okay, whether your baby is term. Risk factors meaning you have G6PD or blood group incompatibility, or you have fever, sepsis, things like that. Okay, we have different different factors come into role. Then we need to risk stratify you. Okay, so we have different numbers. If you can see in the slide here, these are the numbers that we use for ET, for exchange transfusion. If your baby comes near, their reading comes near to these numbers, okay, then we will need to prepare your baby for exchange transfusion. Okay? So I can't give you a number. There is a variant.
There is a variant.
Yeah, I hope that helps, Mr. Goh.
So can I say that usually the matters will resolve with how many treatments of phototherapy, would you say?
Okay, phototherapy is just a mean to help to reduce the jaundice faster. It does not treat the cause. It does not treat the cause. The baby will need to outgrow it.
Okay.
So please remember that it doesn't, after phototherapy, the baby might still become jaundice. Okay. But usually we will make the jaundice drop much below the treatment level. Okay, so baby doesn't need to be warded again for the phototherapy. Okay, so normal baby usually by 2 weeks they will be able to overcome the jaundice. Okay,
within 2 weeks approximately.
Yeah, within 2 weeks.
Right. Let me have a quick look at the comments. Okay, from Marcus. 小孩多久没退黄就算很危险? So can I say the answer is 2 weeks?
Yeah.
Yeah.
But if your child is still jaundice within 2 weeks of life, please come for a checkup. Okay, so that we can make a full assessment. Okay. Most of the time, if the jaundice is not very high, okay, it doesn't need phototherapy. But we just need to make sure everything is doing well.
It's doing well. Okay. Right. So from Miss Tay, good day, Dr. Chiu. If a newborn more than 14 days and jaundice level at 17, baby still active, poo and pee also okay. Will baby requires a checkup, like urinary tract, for example?
Yes, you will need.
They will need.
Yes.
Okay.
Checkup.
You will require the checkup, yeah, Miss Tay? Let me just have a quick look. Is there any side effects during the phototherapy?
Oh, I just mentioned in my slide. Let me go through again. Actually, the side effects are very minimal, so don't need to worry too much about it.
Okay. Yeah, I think I remember you mentioned about some rashes, right?
Yeah. Oh, sorry.
No, have you come across any patients that actually complain to you, wow, we suffer from side effects after doing phototherapy?
Most of the parents that come, they're surprised that the baby needs to be, exposed.
Okay.
Because, whenever baby exposed, they cry, don't feel comfortable, they don't feel safe, and they feel that we are doing something evil for the baby. Okay. So, but I have to explain to them that this is how phototherapy works. Baby will get used to that feeling of being exposed in a short period of time. Usually they'll cry first, then after that when we soothe them, they feel the warmth of the phototherapy, they're okay. They're very okay. So anyhow, this is just the slide about side effects of phototherapy lah. As I said, some babies might get a bit rashes and diarrhea. Okay, but most of the time, whenever the baby is out of photo, this resolve very quickly. It doesn't need any treatment. It's a very short-term duration only.
Very short term and very mild. And as you have mentioned, usually it's not cold. Maybe a lot of parents worry, oh my God, my baby will get cold. But usually you provide like something like a heating pad underneath, so the baby should feel very comfortable in it.
Actually, we don't provide a heating pad. Just the heat from a phototherapy just warm the baby up.
Just warm the baby up. Okay.
So some babies actually do get a bit overheated at night.
Overheated.
Yeah, but we don't really see this in our setting because our environment is air conditioned and also
Air conditioned.
yeah, so it's well tolerated. Don't worry about it.
Okay.
Yeah.
And we have Dennis here. Dennis asks, would you recommend home phototherapy?
So, this is a very good question. I think this is a trend now. Okay, so I do see a lot of phototherapy rentals around. So I would say it depends on the user, okay, who the parents are, okay, and who the caregiver are. So if you have a good support system, I think it's a good option. Okay, since the mother and child can still be together in a comfortable environment. Okay, but baby still needs to be monitored. Okay,
Still need to be monitored.
yeah, it I would say it is effective, but the ones in the hospital, phototherapy in the hospital, I would say is even more effective.
Okay.
Better lah, I would say. But okay, I would say this can be an option for parents. Yeah, no harm.
Okay, thank you. And I have Miss Dinah. She said, I joined in late just now. Is the mother diet during pregnancy could affect this baby jaundice?
Oh yes, definitely. Okay, so there are some studies here in Asia that are trying to see whether what sort of diet from our Asian mothers that can cause babies jaundice, because there was a time where we do see a lot of babies become jaundice, and some, especially Asians, the Chinese, okay, they tend, and when the mother takes the wine, Chinese wine, or a lot of ginger,
Okay.
yeah, so that does affect baby becoming jaundice faster or even higher. So yeah, I would say try to stay away from this sort of diet. Okay, just eat normally. You can have ginger, but not in excessive amount. Okay, try to stay away from those alcohol. I think most mothers wouldn't take it. Just yeah, try not to take it even more during this confinement period.
Just a reminder to all, you can take anything, but take it at a regular amount, not excessively. That should do good.
Yeah, and please, mothers, you need to take more calcium. Things that are high in calcium and iron. Okay, because you will need a lot of that during the breastfeeding process.
Calcium and iron. Okay. All right. And we have Mr. Lim. Should parents use sunlight for normal jaundice? I think Dr. Chiu mentioned no. Okay. Because Chinese 陪月妈妈, the confinement caregiver, will recommend this most of the time.
Or you mean the sunlight?
Yeah, sunlight.
As I mentioned, it's not recommended. Okay, so because for the sunlight to have to work, you need a very long period of time. I don't deny during ancient times, for the sunlight is the choice, is the treatment for jaundice. Okay, but in our area, in our situation here where it's so hot, okay, I do not recommend it. Okay, yeah. So and in Malaysia, we can't expose the babies out in the sun for a few hours. not even 1 hour. So it won't be effective.
It won't
So
be
no, it's not recommended.
not recommended. Okay.
Mm.
So, well, the time passed very fast. It's already about 50 minutes. However, I still have a few questions. So I'm going to take the final 2 questions, yeah, Dr. Chu. So I'll let you off back to see your patients. Okay. I've got Wyming here. So pretty long questions. Hello, good afternoon and good day to you, Dr. Chu. May I know what exactly is the correct invasive procedure for detection of jaundice? Edison, yes, that Edison had about a syringe of blood taken at the back of his palm instead of those taps on the heels. And I was told the former is the correct procedure. So which one is the right procedure? The about a syringe, blood taken at the back of his palm, or those taps on the heels?
Okay, so I think he's referring to those heel prick or the one that we prick over the veins. Okay, so heel prick is a very quick way to take blood. Okay, so when you take heel prick, meaning we just just prick the skin over the heel, baby's heel. So needless to say, it's a very small prick, so the yield of blood is much lesser. Okay, so I would say it's a very good way to. It's better than the bilirubinometer, since it's taken from the blood. Okay, but the amount of blood is very small, so there tend to be error as well. Okay, but it is better than, it's quick and it's less painful, and it's better than the bilirubinometer. The ones that we prick from the veins, okay, usually we prick from the hand. Okay, so that one we take a good amount of blood. Okay, so usually we get the hand prick, okay, during when we need to do prolonged jaundice checks, the more thorough checks. Okay, we would, because we need more blood to make sure everything is okay. So
that's
I would say the hand prick will be more accurate because the amount of blood that we take is more. So that runs for less error.
error. Okay. Thank you, Dr. Chu. I hope we answered you, Wai Mei. Okay, last question, Dr. Chu. Dr. Chu, do we need the doctor's permission to conduct home phototherapy?
Oh, definitely so. Definitely, you need to be supervised. Okay, so even though those parents who do their home photo, I would still advise the baby to bring the baby back every day to the clinic
for monitor.
Yeah.
All right. Okay. I think we have gone past our time. Right. Thank you, Dr. Chu, for your sharing. And I hope if you do enjoy and learn a lot from our session today, please like and share our Facebook page, because definitely we are going to have more such videos to be shared, or to do a Facebook Live again in the near future. And thank you, Dr. Chu. So before we end, so let's say goodbye to our everyone who's watching here.
Okay, see you. Thank you for asking the questions.
All right. Okay, see you later. Bye-bye.